Hey guys, it's Elliot, and I am about 1 month and 1 week post-op. So this is just going to be my 1 month update video, and I thought I would just kind of go over what's been going on, and I'll show my chest, and I'll explain what I've been doing to take care of my scars, and how Dr. Tobias directed me kind of post-op and what I'm supposed to be doing. So, I guess I'll show my chest now. That would make sense. Okay. I'm like kneeling on my floor, so this is like kind of weird. But this is my chest. You can see the drain holes actually have a pretty big scar. I think my body just scars easily. I also had problems with healing them. The scabs kept ripping off, and it would have to like re-heal. So they are kind of big, but overall you can see that the scars themselves are thin. It doesn't meet in the middle. It almost does, but there is space between them. And I guess I can show my nips up close. This one sticks out the most. It actually like protrudes out. And this one had more trouble healing, I think because it sticks out more. And you can see the scar around it, but I don't really mind. You can't really tell from far away. And then this one is more flat. Doesn't stick out as much, but it still does stick out. And on this side, right here, right after surgery, you can kind of see there's a little like wrinkling here. And I read that that goes away after a little while. And you can't really tell from this angle. It's just when the light hits it a certain way, you can kind of see. But it looks way better. It used to be much more prominent before. But the wrinkling has gone down, which is good. But yeah, this is what it's looking like. I think it looks really good, really natural. The nipple placement's like perfect. And the scars themselves are like thin. So I'm hoping that they will get less red over time. But right now I'm really happy with it. I explained in my last video that Dr. Tobias doesn't put a binder on post-surgery for 1 week. You just have drains and then surgical glue over the scars. Hey y'all, quickly jumping in to add a little clip that I forgot. It took like a good 4 weeks for all of the surgical glue to come off of the scars and the nipples. I was like really worried that like it was taking too long, or like that it was bad or something, but like I had surgical glue on like my body until last week, which was like a month post-op. So don't panic if it's like not coming off, and just like let it come off naturally, because I did read that if you rip it, you can rip out stitches that are inside the scars, or you can accidentally like rip off healthy skin graft on your nipple, which could result in like discoloration, or it could make it not heal right. So just like let it be, and it will come off in the shower, and it will eventually just like peel off like really slowly. But yeah, it took a long time for that to happen. You get the drains out about 1 week post-op if they're ready to come out, and then you wear a binder 24/7 with nipple bandages and gauze for 2 weeks after that first week. So 3 weeks post-op, you're supposed to get the binder off. I wore my binder for 3 weeks instead of 2 weeks because he didn't have any appointments, because it was around the holidays. So the earliest I got my binder off was literally 1 month post-op. I got my binder off. Now, I was kind of annoyed by this because it meant that for that 1 extra week, that other people could start, scar massage or lotion or whatever they wanted to do to take care of their scars, that I couldn't do that. I don't think that really does anything. It's only 1 week. But, I mean, personally, I was like, no, I want to, like, start. I want my scars to look perfect, blah, blah, blah. So I was, like, kind of annoyed. But anyway, that's how it worked out, and I got my binder off, and he basically was like, yeah, you're fine, you can do whatever you want. And this also kind of threw me off because most other people, I feel like their doctors are very particular of how they're supposed to take care of their scars, what products they're supposed to use, if they're not supposed to go swimming for a few months or something, or they're supposed to wait 6 weeks post-op to work out. But Dr. Tobias was very lax about it. He was like, yeah, you can work out, like do whatever you want, you can go swimming, you can do whatever you want, basically. And I kind of was like, huh, that seems wrong, but I mean, he's a doctor, and his results look great, so I'm still taking it easy. I still haven't worked out yet. I wanted to wait like 2 months post-op, I think, just to make sure the scars don't stretch and to give my body time to heal a little bit more. I also probably won't go swimming. I mean, it's winter, so I wouldn't really have an opportunity anyway, but I would probably wait at least like 3 or 4 months, because that's what I've seen in other videos. I also asked him about scar care, and he was very candid with his response in that there are no studies that prove any of these scar products work. Like, people love the scar tape and lotions and vitamin E and all that stuff, but there's no proof that any of that did anything more than like just their natural healing, and there's no studies that like show that they do better. So he basically was like, use whatever you think is gonna work for you and like see what works best for your body. So I took that as try literally everything because I'm obsessive and want it to look really good. So I'll go over kind of what I've been doing since I got the binder off. The one thing that I've been doing, even when I still had the binder on, was using this. It's just like Aquaphor. It's just Aquaphor, but I've been using that on my nipples because they get really dry. So I've been using this on my nipples every day, even a couple times a day, because I've noticed that the grafts do dry out, like more than normal skin. And so especially when they were healing under the binder, they would dry out, and like when I would change the dressings, it would like rip off scabs and like make it raw again. So I've been using the Aquaphor a couple times a day for like weeks now, and I like it. It keeps them moist and not as sensitive, I guess. The next thing I've been using is the silicone scar strips, and I usually, what I do is I will put those on in the morning after I shower, and like I dry it and I just put them right on, and I wear those like all day, maybe like about 12 hours. And then I'll take them off and I will put on either this oil that I bought or this lotion that I bought. So I'll show those. I've been using this lotion a lot. It's fragrance free and has vitamin E in it, which is good for scars and for your skin. It says that it helps with scars and like stretch marks and stuff. So I've been using that. And this is really nice. It soaks in really well. It doesn't like kind of sit on top of the skin or like make my shirts greasy or anything. And I also got this oil. It's the same brand. It's Palmer's cocoa butter brand. And this oil is like skin oil. It has vitamin E, and it's has really good reviews for scars. So it says it helps improve appearance of scars, stretch marks, skin tone, and it has argan oil, vitamin E. It's also hypoallergenic, paraben free. It's like more natural than some of the other oils. I really like this brand. So I'll use one of those two and rub it into my scars while I am like watching YouTube or something to do scar massage. And then, right before I go to sleep, after that's been soaked in for a little while, I will put on Mederma. So I only use a little bit of this because this bottle is like fucking expensive. Like this little tiny thing was $25. and your boy's broke and can't afford that. So I only use a little bit, and I've been focusing more on the scar strips and like the lotions, and then only put this on a little bit at night. And I'll rub that in and then just go to sleep. And then when I wake up, I will shower and put on the scar strips again. So that's kind of like my routine that I've been doing. I'll see how it works, because the scar strips are really annoying, and I've only been wearing them maybe for like 6 days, and they're supposed to last like 2 weeks at a time and still stay sticky, and they're not. Like, I've been doing the instructions and they like peel off, and they'll fall off during the day, and it feels like there's like a spider in your shirt or something, and I like freak out. So I'm not sure how long I'll use those, because they're really annoying, but I've just heard such great things about them and how they help the results. So I guess I'll just keep using them. And yeah, I mean, right now I'm almost 6 weeks post-op, and from what I've read online, this is like when the scars look like the worst. It's like this, like around 6 weeks is when they're like the darkest, reddest, most raised, because you haven't really been treating them that long and your body's still healing. So I think that they're kind of dark right now. I mean, compared to others, like, my scars look great. They're thin, they're not that dark. But yeah, I'm really happy with my results. And besides the, like, little guidance in terms of scar care, I mean, I'm sure I could have pressed for, like, more specifics. But Dr. Tobias, other than that, has been amazing. And I'm really happy with my results, and so comfortable. Except it is funny, since I've had surgery and I've been now wearing just shirts, like, with nothing underneath for like a little over a week. It still feels really weird. Like, it's really sensitive. Like, I can't feel my entire chest, and the nipple itself I can't really feel, but it's still like sensitive. Like, I can sense that there's something touching that area, and if it's not normal, because I've never felt that. But it's really good. I'm not in any pain. I still don't have full range of movement, but I can like lift. I can lift all the way up, but it's like tight, and I don't want to stretch the scars. And the scars themselves are sore when I massage, and also right underneath, and I think that's because that's where the drains were. So my body's still like mad that there were foreign tubes in my body, so they're still sore. But yeah, it's really like not a lot of pain. I'm really comfortable now. I can finally sleep on my side. It's still a little uncomfortable where the drains were, but I'm getting much more used to it. And yeah, just healing. I mean, it's only been like 5 weeks, so I've got a long way of healing to go, but it's looking really good. No titties, baby.